Hi friends, good afternoon and welcome you all for one more YouTube session. I hope everybody is ready with their questions and I have few questions on the today on the Skype. So one of the questions I have is about the spine actually. Uh, it's a case of spine where the patient has been prescribed some medicine and is better. He was last better with sulfur 200. So it is the question is basically, yeah, welcome Dr. Avinash, Dr. Palak, Dr. Disha. So the question for this was, is sulfur 200 in water enough or should he change to LM potency and if yes, which potency? Yeah, welcome Dr. Nazimuddin, Dr. Trivedi, Dr. Kocher, Dr. Disha. So the patient had a spine problem. There was a spine compression and the patient had been given a few medicines which did not work, and now sulfur 200 worked very well, about 50% better within 3 days. In my opinion, the compression is, Dr. Bawal, the compression is very severe and the patient will require repetition of LM potency of sulfur. You can start sulfur 0 by 7 and twice a day, take it for a week and then start tapering off depending on your result. It's a fantastic case and a very good result, so you can continue that. Dr. Vishal, welcome. Dr. Babel, Dr. Meera, Dr. Singh, Dr. Yasin, Dr. Sachdeva, Dr. Almagir. So I hope Dr. Babel, your case was very nice and you start LM potency 0 by 7 twice a day for a week, then start tapering off maybe once a day, then once in 2 days, once in 3 days, depending upon the relief of the patient. And The symptom which gave him relief was the patient had symptoms of stabbing pain like knife and sleeps better. So with the stabbing pain, one of the doctors in our group prescribed sulfur 200, and in a case of MRI scan, MRI compression, it's a fantastic result because I have never prescribed sulfur for stabbing pain in case of spine. So it is a learning process for me also. So LM potency 0 by 7 twice a day, once a week, for a week, then you can taper off the dose, Dr. Babel. It's a fantastic case and thank you for sharing the case and the symptom for which you prescribed sulfur. Okay, yeah, can we go further for with another question, or I'll take few questions from my side which I had on the WhatsApp. So there were a lot of questions where there was a fantastic case today in my maybe last week in my clinic, because there is a lot of viral symptoms going on and people are getting sick and fever and all. And this patient had, apart from the symptoms of fever, apart from the symptoms of body ache and headache and throat problem, choking, I gave bupropion purfolatum, but it did not give relief. One symptom with the patient emphasized was there was a lot of choking and he had to swallow like this, and the choking used to be better. And the patient was absolutely chilly, So if you see this symptom, it is a very, very important symptom. A chilly patient choking better by swallowing, and I gave one dose of CPR 200, which cured his fever, cured his body ache, cured his malaise. The learning thing in this process was, whenever if you're taking a case, an acute case, a chronic case, first thing, what is the most important presenting syphilitic symptom of that patient? Because whenever choking comes, constriction, swallowing, has to swallow, we always think about remedies like lachesis, and of course, definitely, yes, lachesis definitely works, but see, the patient is absolutely chilly. So don't think about that chilly snake and then crotalus should come cascavella, not like that. See symptoms very properly. If you see choking, constriction, swallowing, has to swallow, then you have lachesis, you have CPR. Very, very interesting remedy. Lachesis is what? CPR is chilly, CPR 200 single dose, cured that case. If you see a fever of CPR, does not have body ache, headache and all, but still that choking symptom, which was a very, very important symptom of that patient, was cured with CPR. So every time when my students join me, I am giving a lecture, I say, see the most important presenting feature of that patient, so that you can define that symptom, a syphilitic symptom, and then prescribe the remedy. Welcome Dr. Sunita Gaidane. Okay. I hope you understood something about that. One more question. We have fever with upper part of the body and the lower part cold. Whenever if you have this type of symptom, that upper part is body is hot, and I basically in my practice, I generally in fever don't prescribe only on this symptom that upper part of the body is what you call hot and the lower part is cold, because you may or you may not get symptom. There has to be a symptom more precise to the disease, but still if you feel that okay, this is a symptom which I have to prescribe on, so there may be a lot of remedies. Upper part of the body is hot and the lower part is cold. You may think about few remedies, which are very very indicated in that. You may think about arnica, you can think about Paris quadrifolia, you can think about pulsatilla, you can think about arnica. These are the remedies which come to my mind. Of course, though I have told you some remedies, but still, Dr. Yasin, it would be good that if you see some symptoms more in that case, rather than only prescribing on that part where an arnica, colocin, Paris quadrifolia, pulsatilla could work. So ask some more symptoms to the patient before prescribing, because in fever case it is very important to understand that if the fever increases, the patient takes a crocin or takes a dolo and the fever is better, and we feel that with our medicine the fever is better. So few symptoms more, and then you can be very sure in your prescription. Okay. So can we have that question of throat? Yeah, I was telling you something about throat, and it is so important in these conditions where you have symptom. Patient comes to you and tells you, I have pain in throat. Now, whenever pain in throat is there, ask and try to see which type of symptoms are there, which defines that cough. For example, let me tell you one example that I had a case where the patient comes and tells me that I have pain in the throat. Then I ask, where is the pain more? Eating, drinking, swallowing, or anything else without any symptom? And the patient says no. When I start coughing, no, the pain is more. And immediately whole perception of your case, thinking of nitric acid or Hipasulf or Mux Solophytolica changes. Now, whenever there is pain in the throat on coughing, there are few remedies which are very, very important indication. The remedy first is Argentum, second is Capsicum, and third is Merxol. All are three marking remedies: Argentum, Metallicum, Capsicum, Mercury, or you can think about phosphorus and lachesis also. But it is very important to understand if the patient, because any viral infection, the patient comes with symptoms of either nose or throat. Nose is easy because there are a lot of sneezing and all, we have a lot of acute remedies. But pain in throat, then you are in a problem. Then you think about only that 5-6 remedy which are very, very useful. But do think about asking the patient precise symptom of pain, and then it is indicated that you can think about Argentum, Metallicum, or Mercury, or Capsicum, or lachesis and phosphorus, depending upon the symptom as you inquire further. We have few questions on Instagram also. First, I'll do it on the YouTube. Fever in infant with diarrhea, upper part like head, abdomen, very hot, feels fever in infants with diarrhea, upper part like hot, like head, abdomen, very hot, feet cold to cold. Yeah, upper part hot, feet cold. Yeah, whenever you find that a fever is going to rise, welcome Dr. Mukesh, Rangari Mukesh. He's on Instagram. So whenever you find, you'll always see whenever the fever is when the fever is rising, normally the feet turns become cold. But if in long term, if you find that fever is not rising and it's a basic symptom of the patient, then what I told you, that is important symptom. You can add arsenic album to that case, or you can add one remedy to that case is phosphorus also. With what I told you, arnica, anacardium, pulsatilla, these remedies also are like Paris quadrifolia, or also important in infants. See the irritability, see the thermals, see which time of the day he has this differentiation of fever, upper part and the lower part, and whether it is associated with pain or it is painless. If you ask this symptom, then you are very sure that your remedy is right. Yeah, Dr. Baba, good afternoon. So I was just taking about the throat pain, because see, there are so many acute cases now that it sometimes become difficult. Now you have patients where the patient comes and tells you very simple, sir, whenever जब हमारी गाड़ी की खिड़की खुली रहती है, थोड़ी स्लिट है, थोड़ी ओपनिंग है, वहां से हवा आ रही है और फिर मेरा गला बहुत दुखता है. This is a classical symptom of hypersal. Where there is pain in the Shakti Homeopathy Instagram, welcome. Whenever there is pain in the throat from draft of air, then the most important remedy that we all know should be hypersal. Remember the indication of hypersal. I told you yesterday also. Draft of air, hypersal, ambragrasia also. You can have calcarea carb also. But hypersal is a 3 marking remedy. So we did pain while coughing, pain aggravation from draft of air. Before I go further, I'll take one question. Sneezing commonly when there are change of temperature moving from AC room to hot place or other way around. Yeah, Dr. Sachdeva, if the patient comes to you only for sneezing and it is because of either change of weather or change in the room, it is a soric complaint. Just give placebo and tell the patient to take steam, plain water steam, that's all. Because normally a soric symptom, don't treat it, because if you get the remedy wrong, it gets suppressed and goes to the throat and to the chest, and then the patient goes to asthma, and then the patient says, yeah, before maybe 2 or 3 hours I had symptoms of a lot of sneezing, but the doctor gave me the medicine, the sneezing is cured. Actually, it is you have suppressed the sora to psychosis. So simple sneezing, I know the patient is irritable, I know there are remedies, but if I was given the case, I would just tell the patient to take placebo in hot water and just take steam of hot water twice a day, and that should take care of. If by chance the conditions are very, very severe, the patient, the work has been disturbed, if the work has been disturbed and it is causing a problem in his day-to-day life, then you can think about symptoms like where is the sneezing more, how much is the sneezing, and if the sneezing there's water from the eyes, with sneezing the discharge, how is the discharge, it is acrid, it is blend. There are a lot of questions, but basic remedy you can think about change of weather, and there is very generalized remedy, change of season, change of climate, change of weather, change of if anything can cause anything. So whenever there is change in any position, also change, the patient has a sneezing problem, then there are a lot of remedies. That's why basically I was telling you something about this type. Now coryza, if the weather is changeable, there are few remedies which are very, very important, Dr. Sachdev. You can write down: sulfur, kali iode, hypersulf, arsenic, which I use in my practice. Sulfur, kali iode, hypersulf, arsenic album. Yeah, Dr. Vishal. Sir, you have told you will be re-uploading the LM potency deleted video. Please do. No, I have the LM potency video on the YouTube. I'll tell you, it was, I think, 1 year back on Hahnemann Jayanti, I think 11th and 11th April. So you can again go and watch my LM potency on YouTube. I think it is there. I'll just WhatsApp you the exact date if I'm missing out. Okay. Just check there, LM potency. Yeah, I hope Dr. Sachdev, you got some inputs about the symptom. So I was there in the pain in the throat. Okay. There are a lot of assistant doctors who basically ask me these type of questions. So I just tell them, be very clinical, see some clinical approach and see some clinical symptoms. Now when the patient comes and tells you pain in the throat when I start eating, this is something very, very important. Pain in the throat is increased while I start eating. There are very, very, yeah, Dr. Vishal is on Instagram, so I've just answered his question. So pain in the throat while eating, 2 remedies, very, very important, you have to remember. The first is phosphorus and the second is a very, very important remedy. I don't know whether you have used that remedy in your practice. The remedy is ferrum metallicum. Very, very important remedy. So pain in the throat while eating. Exactly opposite. The patient comes and tells you my pain is better when I start eating. Then the remedy changes. Lachesis, picric acid, and a very important remedy again, sister scan. So this is how your approach of materia medica should be. Every symptom you must have at least 2 remedies describing symptoms, aggravation, amelioration, both, so that you're very clear in what remedy you have to give to the patient and what remedy have to be eliminated. For example, when I had a case where the patient came and told me, whenever I take in air, I get pain in the throat. Now what will you take? The patient has not told you it is draft of air. The patient has not told you it is uh, the normal air. He is telling you that whenever I start taking breathing, inspiration causes pain in the throat. And then you have to think about very, very important remedies. Again, in this case, the first remedy is Hipar sulf. The second remedy is Argentum nitricum. And the third remedy that everybody should know, maybe you have not used this remedy in your practice, but you should know this remedy, and that remedy is Elianthus glandulosa. I have told you some symptoms of Elianthus glandulosa, but a very, very important remedy when the patient comes and tells you there is a pain in the throat on inspiration. See the difference now? Inspired air, draft of air, open air, northwest wind, aggravation. For every symptom, the remedy changes. That's why your Mater Medica in acute has to be very precise. So you take one symptom, a very, very indicated remedy, and then you can get wonderful results of a single dose of medicines. Now, it is always important to know that whenever there is in relation to menses, the patient comes and tells you pain in the throat before menses. There may be a lot of remedies, but two remedies I have found very, very useful. The first remedy is Laccan. My dear doctors, if you have not used Laccan for throat complaints, that means you have not studied your Mater Medica properly. Laccan is a very, very important remedy, and everybody should know something about Laccan, because it is said that Laccan, if you have not read Laccan in throat, that means you are not curing lot of cases of patients who deserve Laccan, and you are suppressing it. Now, Laccan, as you know, it's a very, very important remedy for constipation that we all know. But Laccan has a very, very important symptom in relation to throat. And clinically, I have found very good results of Laccan when the patient comes and tells you there is pain on swallowing and the pain extends to the ear. This is a very, very important symptom of Laccan. We have one more Dr. Gyanchandani from Instagram. Pain in throat while swallowing extends to the ear, and the appearance of throat of Laccan, just open the mouth of the patient and you can see a shiny glazed appearance of deposit, pearly white deposits, pearly white deposits on the white patches. That is Laccan. Of course, phytolecca is also there in pain extending to the ear. And a Laccan patient will have stiffness of the neck. Those three symptoms of Laccan I have found so many times in my practice, and that has given me beautiful results. Remember one symptom of Laccan, I'll tell you something in Hindi. पेशंट बोलते हैं की मला असं वाटते की असं काय गुदगुदी होते इथे, आणि जेव्हा मला असं वाटते की ते गुदगुदी होते, मला खूप खोकला येते. दिस इज मराठी. हिंदी पेशेंट बोलेगा डॉक्टर साहब मुझे यहाँ बहुत गुदगुदी होती है और फिर बहुत खांसी आती है, बहुत खांसी आती है. This is the wordings of the patient of Laccan. He says, I feel something irritation, something gudgudi type, and because of this, I get constant cough. Now, this symptom I have confirmed in so many cases of throat complaints and cough. Sometimes, with this one symptom also of this, I prescribe Laccan, and that has given me very good results. I am telling you something very clinical. I am not getting into symptomatology of Laccan, but this is clinical. So pain in throat before menses, Laccan and magnesium carb. Now magnesium carb, if you see magnesium carb, it is important in menstrual complaints where the menses comes mostly or flows in the night. So I am basically trying to tell you some clinical symptom of throat pain which you should remember. Very, very classical symptoms of remedies of Lacan, and very what you call clinical approach of pain in the throat when the patient tells you these type of symptoms. Okay, and of course there are a lot other symptoms of pain in the throat because of this yawning or eating, but that is not, I have seen not many cases in my practice, so I'm just telling you something very clinical of pain in the throat. Okay, so few questions more, or I'll ask something, I'll continue that. Any questions? You can keep asking me questions, because if there are no questions, I keep speaking. Now, there is one, there's no question. There was one patient where the patient comes and tells you that I get a lot of cough. And when the cough subsides, I have pain in the throat and there is a burning pain in the throat. But let me first tell you, this just yesterday's case, a patient came me, my daughter has lot of cough, and there is one sneezing and she is better. Then after some time she coughs, there is sneezing, one sneeze and she is better. Which remedy comes to your mind? I gave the remedy, that remedy one single dose, and the patient was cured. See how the mother narrates the symptom. My daughter gets lot of cough, dry cough, barking cough, lot of dry. She sneezes and the cough is better. Post-nasal pharyngitis cough. Dolly says sore throat, please explain. Okay. What I'm asking you, the patient says that I have got lot of cough. My daughter has got lot of cough. She sneezes and the cough becomes better. I gave that lady, that child, one dose of the remedy and the cough was cured. Can you think of that remedy? Anybody? You can think about the remedy. Before that, I'll just answer the question of Dr. Yasin. She says, Dolly says throat complaints. Now, Dolly says, remember, it's again a very interesting question, Like we have, I told you Lacan, I told you Phytoleka, Dr. Baba told that pain in the throat while swallowing and it enters to the ear. Same symptom, that pain in the throat worse on swallowing below the right angle of jaw. Below the right angle of jaw. That is the throat complaint of dolisis. And a dolisis patient has so much pain in the gums, it prevents sleep. These are the two, I was just thinking about symptoms, yes. So the remedy was, any other guesses? If you open a Mater Medica, it's a fantastic tool, Cough or dry cough ends in sneezing. Dry cough ends in sneezing. I did not prescribe the patient osmium. Of course, in osmium it is there. In Seneca it is also there. But I prescribed the patient single dose of Squilla 200. 3 remedies I have found very useful when the cough ends in sneezing. First is Squilla, second is Agaricus, and the third is Argentum nitricum. Very important remedies. Very important remedies when the patient comes and tells you the cough ends in sneezing. I hope you understood something about that. Very practical approach, and I told you something about dolisis also, which whatever I remember now of dolisis. But very important symptom of Squilla. There is a lot of sneezing, and the margins of, there is one answer in the Instagram, Dr. Vishal says Justicia Adha Thoda. It is not there in Justicia. So fluent coryza, Elimsipate is not there. Squilla में क्या होता है? Fluent coryza and the margins of the nostrils are red. That is Squilla. Remember, I told you one symptom of Squilla. It is very important that there is lot of sneezing, there is lot of dry cough. The patient has to take deep breath and the patient is better. This is a symptom of Squilla, And one symptom I told you about squilla, very, very important. Can anybody recall that symptom of cough of squilla? Very, very clinical symptom. You can see the patient and prescribe squilla. Can anybody tell me that symptom which I told you maybe 6 months back on YouTube, or it is there on my YouTube cough videos? Anybody? Anybody? Can anybody? Instagram also I have a lot of persons now. Can anybody tell me the symptom of squilla, which I told you is a very, very rubs the face with fist? Yes, that is squilla. It is like this. Squilla. A squilla patient rubs the face with fist during cough. Very well said, Dr. Vishal. Very close to two remedies. One is causticum and second is pulsatilla. So these are very, very important remedies where you can just prescribe by seeing the case and then prescribe it. Okay. Very well answered, Dr. Vishal. Holds the chest. Yeah, it is there, but the most important symptom of squilla is that the patient rubs the face with fist during cough. Compare that with causticum. Compare that with pulsatilla. Yes, so do we have a few more questions? It's already 3:30. So do we have a few questions more? Otherwise, when I start mathematics or telling some symptoms of throat and pain in the throat, there will be a lot of other हाथों को आंखों और टारगेट है. हाथों का आंखों और टकराते हैं. ठीक है. Okay, Dr. Yasin. So there was yeah. So we completed some throat complaints. Do read about these symptoms which I told you something about throat. Do read about some remedies also which I told you, because these remedies I have used clinically in my practice, and whatever symptoms I have used in my practice or seen in my practice, I have told you. So make sure that you basically understand what I want to speak. We are basically concerned about the clinical mathematics, clinical approach. Whatever I have seen in my practice, I am trying to share that experience with you. I am not telling you by the pain in the throat is tearing pain in the throat, or going pain in the throat, or splinter like pain in the throat, or ulcerative tract pain in throat, and remedies for each type of pain. Because I have not seen patient describing some throat symptom like that. Whatever I have seen, I have told you. For example, the patient says there is a lot of pain in the throat when sneezing. I told you pain in the throat when coughing. So there is one symptom the patient tells you there is pain in the throat when sneezing. And if you see, there is the most important remedy in that is, which? Phosphorus. Phosphorus has a very, very important symptom in relation to pain in throat, and that is sneezing. So, do we have some more questions? Yeah, so one question from Dr. Bilwalkar. Black lines on nails. Yeah, so now, see, we are basically now talking about something which is related to what you call answer of medicine. But whatever understanding I have about these type of nails, I'll tell you something. First of all, understand that these type of complaints basically are the result of trauma. Trauma is one of the most common cause. There is a splinter hemorrhage, and that can cause that black lines in the what we call nails. Now, the trauma can be maybe it is said that the trauma can be very much trivial or severe both. In some conditions of the body, also like endocarditis, we have this type of conditions, or psoriasis also. The splinter hemorrhage, there is a splinter hemorrhage like an infection, vasculitis, or lichen planus also we have these type of complaints. So this is basically these type of medicine question, whatever I could understand and whatever I know about that. Sometimes in chemotherapy also you get black lines in the nails, when what can be the given to a young patient who gets apathetic without feeling from without feelings from cannabis use. I didn't understand the question, Dr. Babel. The patient apathetic who gets apathetic without feeling from cannabis use. I didn't get it. Can you explain the question more? Next question, Dr. Yachin has pain in heel region. Patient wears shoes shorter than feet for some days, unbearable pain, and waking in morning, gradually better walking. Yeah. This is maybe, it is not that he is not worn shoes properly. This is maybe plantar fasciitis. There are some very, very common and very, very specific remedies in this type of complaints. You can use, you can take the help of remedies like Arenia diadana, Ledum pal, Calcarea flor, Arnica, and Guaiacum. This is my experience, common experience in treating these type of cases. Dr. Chatterjee says, sir, can you please help us about your favorite mother tinctures you use in your clinical practice? As such, there is no favorite mother tincture of late which I use in my clinical practice. Maybe years back, I used to use some mother tinctures like Berberis vulgaris for stone, or what do you call, which mother tincture? Yeah, Guaiacum for maybe pain in the bones, Nigodium for pain in the bones. I used to use Berberis equifolium for pimples. I can't remember any because I have not used of late mother tinctures as such. These are the basic, or sometimes when there is a lot of pain of the renal colic, I used to use Prunus spinosa. But of late, for years, I'm not using it, so I cannot comment properly on this this question. Dr. Babel, I'm waiting for a question. So whatever I could understand from the question, I don't know if you're telling something about apathy or indifference, basically. Whenever if you're basically using a narcotic and you feel that indifference type, you may use 3 or 4 remedies which that comes to my mind which I had used. First is opium, second is thyroidinum, third is tabacum, and fourth is China. Yeah, whatever I could understand from your question, whatever I'm answering. Okay. So next question, or something about pain in the throat again. So I was telling you, pain in the throat with sneezing, very, very important remedy, phosphorus. And Rauwolfia mother tincture, yes, for blood pressure, yeah, you can use that. But I have found that when you use Rauwolfia or Crataegus, it may be basically help you for 1 or 2 months and then again back to square one, and the remedy does not work. So that's why I don't use those medicines now. So please guide us if the stone stuck in the right side ureter. Yeah, stone stuck on the right side ureter. Just see whether the patient is having which type of symptom at that time. Whether the patient has pain, define the pain. Whether there is a sensation or bubbling sensation or some sensation, or there is no pain and the patient was only diagnosed just by a chance when he went for an X-ray or a sonography for something else. So find out some more symptoms, because the approach would be same like normally we treat any other stones. So just find out some more symptoms and then we can easily get to the remedy, Because as such, just right-sided stone, I would not be able to answer that question. But still, if you get some cases where you have only right-sided complaints or right-sided stones, there are remedies which basically work more for the right-sided. And the most important remedy for right-sided complaints which I have seen, Argentum metallicum, Aurum metallicum, pulsatilla, Nux vomica, Lycopodium, Crotalus horridus, Crotalus cascavella, Conium, Calcarea, Bryonia. These are classical right-sided remedies. Of course, each remedy has its own typical symptom to prescribe for that ureteric stone. So consider a stone as basically as what you call the disease part, and take the whole case or the particular part case, symptom, sensation, pain, and the modality, and then you can prescribe. Vomiting only, yeah. Whenever there is, whenever there is stone renal colic or any colicky pain, the first symptom is vomiting. So this is basically a reflux symptom because of the vomiting center is stimulated because of the pain. So you cannot prescribe only for vomiting, because it will never work, because it's a normal symptom of a renal colic or a ureteric colic. We have Dr. Bijit on Instagram. Welcome. In fact, we are through with our half an hour of YouTube live. Any more questions, or is it through with that? Okay, so I think all questions. There's one question, sir. Patient having slight pain during ejaculation but has no pain during urination. Oh, just now we had a case, just a day back we had the same case, and I'll tell you in the pain because of ejaculation, you can think about calcarea carp and clematis. But I have found some remedies which are useful, not given in the Matermedica, but still I have got you. That is rhododendron and hamamelis. In books it is written calcarea clematis, but rhododendron and hamamelis also has given me very good results. So I think it's time. It's already half an hour. And thank you all for joining, and thank you for your time. Thank you. Until we meet on next Saturday. Thank you.